Assalamu alaikum everyone, good day. Today we talk about building fair and meaningful assessment beyond the grades. Assessment in medical education is multifaceted. It drive and simulate learning. It provide information about the education efficacy and protect patients. Let us take an example. Examinees need to know what is expected from them, and they need to receive feedback about their performance. Teachers and educational institute, they want to know if they are meeting their mission, if they are meeting the requirements and the standards for accreditation and for governance bodies. And the community, they need to receive safe service through our outcomes. And this is what we are graduating graduates who fit the purpose. Assessment criteria are necessary to ensure that the results are guaranteed, but it different in its level of importance depend on the stakeholder and depend on the assessment purpose. There are 7 criteria for good assessment: the validity, reliability, equivalence, feasibility, education effect, catalytic effect, and acceptability of the exam or assessment method. The importance of each criteria, as we said, is depend on the purpose of the assessment. Is it formative assessment or summative assessment? Also depend on the beneficiary or the stakeholder. The need for the students is different than the need of teachers, different than the need of community members. Let us talk first about the validity. Validity refers to whether an assessment actually measures what it is intended to measure. For example, if we will test a surgical skill of attendees with only a written exam, it will give us incomplete and misleading picture. Because as you know, if we will test the surgical skill, that means we need to make a hands-on examination. The validity have different types, like content validity, the extent to which the assessment cover really all relevant part of the learning objectives. And this is what is usually covered through the blueprinting, what we will learn about with Dr. Amira. Constructive validity, are we using a method that can measure the skills, knowledge, behavior that we want to assess or not? For example, if we are measuring the communication skills for a student, then we need to make direct observation for doctor-patient interaction, not just simple MCQ. And we have predictive validity. Predictive validity is referred to how will performance on the test predict the future performance in the real setting. Like, for example, if they are performing very well during the OSCE, are they going to perform with the same qualification with the patient in the clinical setting or not? How validity established? Two complementary approaches are commonly used. First, the expert-based approach, where validity is assessed by relying on the informed judgment by the subject matter expert, where the expert examines the test blueprint, the content items, and the assessment method to ensure that the assessment align really with the intended competencies. And second is a data-driven approach. Validity is demonstrated using a statistical evidence that link assessment performance to real-world outcomes. Like, as we mentioned before, it's correlating the OSCE result of the students with their later clinical performance in the clinical settings. Second is the reliability or reproducibility. Reliability is the degree to which an assessment produces consistent and reproducible result under similar condition. In another mean, if a test is reliable, a candidate who take it again under same conditions should get similar results. What are the factors affecting the test reliability? First is the length of the exam. Longer tests generally have higher reliability because it will cover more contents. The contents coverage, more sampling across the curriculum for sure will improve the reliability. A clear scoring rubric reduces the variability between raters or examiners. Training of examiners improve inter-rater consistency. And here the first two also will cover during the blueprinting. If we will compare validity and reliability, validity it means the accuracy. Are we measuring what we are expecting to measure? Are we measuring the right things or not? And reliability it's mean the consistency. Are the results stable and reproducible or not? A test can be reliable but not valid. Third is the equivalence. Equivalence means that the scores, interpretations, and results decision are comparable across different contexts. Without equivalence, two students with the same ability could be unfairly either advantaged or disadvantaged depending on where and when they took the test. Equivalence ensure the exam administered in different institutions, times, language, or format even produce the results that are fair and consistent. How is equivalence ensured? First, through the standard setting methods, consistent cutoff scores across institutions and time. So we have a score, setting score during in different exams that can take place in different places. Second is the moderation, independent review and adjustment of scores to account for examiner variability, and this is common in OSCE. Items banking to use large calibrated pools of questions, examiner training, regular sessions to align making criteria and reduce variation between raters or examiners, quality assurance, this is related to ongoing monitoring of the exam performance, and finally benchmarking across different institutions. And if we go back to the key differences between them, we will find that equivalence ensures the fairness across different contexts and users. Exam can be valid, measure the right things, can be reliable, it's consistent and reproducible, but can still produce unfair outcomes without equivalence. Third or fourth, let us talk about the feasibility. Feasibility is the degree to which an assessment is practical, realistic, affordable, and sustainable within the available resources and context. It talks here about the budget. Can this assessment be implemented effectively without overburdening either the staff, learners, or budget? What are the key dimensions to ensure the feasibility? First is the human resources. Do we have available and trained examiner? Do we have available standardized patients to run the assessment or not? Time requirement, this is include the exam preparation, exam administration, scoring and analysis. Financial cost, either it's direct or indirect. Direct financial cost like the printing cost, online platforms cost, simulation cost, or indirect is the faculty members' time and administration overhead cost. Infrastructures and logistics, this is related to the facilities and technology. Do we have enough exam halls, OSCE labs, online testing platforms, and so on? Again, if we talk about the key differences, we will found that validity is measuring what we're supposed to measure, and reliability is the reproducibility of the result, equivalence to ensure the fairness, while feasibility is to be realistic about the cost consciousness and sustainability of the exam. So here we will find there is a trade-off between psychometric strength, what we said here, and the feasibility, because the exam can be valid, reliable equivalence, but with high budget or unavailable resources. Fifth is the educational effect. What is the educational effect? It refers actually to the influence an assessment has on how and what students learn. As you know, students usually they will study what they expected to be tested on. What are the strategies we can use to maximize the positive educational effect? First, align assessment with learning outcomes and competencies, and this is what is covering through the blueprinting, using a variety of assessment methods such as MCQ, OSCE, workplace, also we cover through the blueprint assessment, provide constructive feedback, and blueprinting to ensure the assessment to drive really the learning across the full curriculum, not just a selected area. Again, if we'll go to the key difference, we will find that the educational effect, how assessment shape preparation before the test, shape the students' preparation for the test before the test. And here the key difference is the validity, reliability, equivalence, and feasibility, all talking about the quality and practicality of the exam, while the educational effect focuses on learning impact and motivation of the students for the exam. Next is the catalytic effect. The catalytic effect refers to the extent to which an assessment simulates further learning and development by providing useful, timely, and actionable feedback. That means it's after the exam or after the assessment. While the educational effect shape what and how students prepare for assessment, the catalytic effect is about what happened after the assessment, how learners use the results and feedback to guide their next future step. Let us talk now about the key features of catalytic effect. First, we need to give timely feedback. Second, actionable feedback. Not just for the scores, but we need to be specific and with practical guidelines for improvement. Let us, for example, take example about weak communication with a patient. Instead of telling to the student, you have weak communication with a student, we need to be very specific. We can tell him, you need to pause more and check patient understanding during the explanation. Next, forward looking. Forward looking is how to connect their current performance and your advices with the future expectation. This will help the learner to know what to focus on next and not just what they did wrong. And finally, adaptive and individualized feedback depend on the student's status, level, and scenario. Strategies to enhance the catalytic effect. First, we need to design assessment with built-in feedback, not just grades. Train faculty members on feedback skills, how to make it constructive, specific, and learner-centered. Try to use some structured feedback tools, such as checklists. You need to close the loop, close the communication. Give the feedback and listen for the student, and how the student act upon your feedback. And finally, encourage the longitudinal tracking through the portfolio and analysis of the action of the students. Okay. Let us talk about key differences. Validity, is it measuring with what it's supposed to measure? Is it consistent? It is fair. Is it fair? Is it feasible? Can we tolerate the budget and resources? Educational effect, we said how student prepare himself before the test. Why catalytic effect is what feedback we give him after the test, how assessment simulates future learning. So the educational and catalytic effect actually make assessment not just a tool for judgment, it's a drive of continuous improvement, a drive of long life learning journey. Finally is the acceptability. Acceptability is the degree to which the stakeholders, such as students, faculty members, examiners, administrators, patients, and sometimes the public and investors, perceive the assessment process and its outcome as fair and reasonable. We can ask ourselves, do people trust the assessment and decision based on it? Like the national exams, they are licensing the students to practice or licensing the graduates to practice. Are we believing in this examination to ensure the safety of patients? What are the strategies to enhance the acceptability? First, we need to try to involve the stakeholders as much as we can, like faculty members, examiners in test design, of course, and blueprinting. Communicate clearly about the purpose of the exam, the standards, expectations, scoring rubric, and the feedback. Ensure fairness and standardization. This is through training of the examiners to use also structured scoring rubric and moderation of the results. Providing feedback, as we said, timely feedback and constructive, regular review and evaluation to improve future examination process. Okay, let us talk again about the key differences. As you know, validity is measuring the right things. Reliability and the consistency of the exam. Equivalence to ensure the fairness. Feasibility to ensure that we have enough budget and resources. Educational effect, how assessment shape the preparation before the test. Why the catalytic effect, how assessment simulate the future learning after the test. But acceptability is about the perception of fairness and credibility of the test. So all related to technical and educational quality and practicality of the assessment, while acceptability is about the perception, trust, and how stakeholders buy in your assessment methodology. In conclusion, the importance of each criterion depends on the purpose of assessment. Formative or summative, all of them are important, but the level of importance depends on the purpose of the assessment and the stakeholders' perspective. Thank you all for listening.